Let's talk in a frank, welcoming, and taboo-free way about how to increase sexual desire in old age without having to resort to medication, understanding that this is a phase of life full of physical and emotional transformations, but that at the same time, it can be lived with a lot of fullness, self-knowledge, and pleasure. Many people believe that as they age, sexual interest must inevitably drop or fade, but this does not correspond to reality for everyone. For many, it is a natural change of body and mind, but it can be circumvented or mitigated with some practical and daily attitudes that value physical, emotional, and relational health. Our meeting today aims to create a safe space where we can address the subject in an open, respectful, and informative way, so that you feel supported on this journey. From now on, it is important to reinforce that there is no shame in wanting to improve pleasure, seek new experiences, or rekindle the flame of sexuality after the age of 60, 70, or even 80. In many cultures, talking about sex at this stage of life is still a big taboo, as there is the mistaken idea that sexuality is the privilege of only younger people. But the truth is that sexuality is part of human nature at any age, and sexual desire can indeed continue to be present. It may express itself differently than you did in your 20s or 30s, but that doesn't mean it needs to be any less satisfying. To better understand what may be affecting sexual desire, let's think about some common factors that appear in old age. One of the best known is the hormonal issue. In women, menopause generates a drop in estrogen levels, which can influence vaginal lubrication and libido. In men, andropause can result in lower testosterone levels, also altering sex drive. However, the way each person experiences these changes is very particular. Some practically do not perceive major transformations. Others feel it more intensely. In any of these situations, what really makes a difference is the integral care of one's own body and mind. Physical exercise, adequate nutrition, attention to mental health, and, above all, an attitude open to dialogue are initiatives that can bring significant results in improving sexual desire. It is also necessary to consider that, over the years, we go through different life experiences, which can influence the way we see our body and our sexuality. Some people accumulate traumas, insecurities, or frustrations that can have a direct impact on their libido. Others experience moments of stress, anxiety, or depression, which can also be reflected in decreased desire. It is not just a biological process, but a sum of emotional, affective, cultural, and relational elements. And precisely because it is something multidimensional, it is worth looking at this subject with due attention, looking for solutions that consider all these aspects. Therefore, before any practical tip, it is essential to remember that the path to a satisfying sex life in maturity passes through self-esteem and self-knowledge. Respecting the body's limitations but also exploring its new possibilities is an important step. Many couples who begin to face difficulties in the relationship, either due to lack of desire or physical discomfort, realize that a frank conversation about the subject opens doors to rediscover new forms of intimacy. This may mean modifying old habits that once worked, but are now no longer pleasurable. It can also involve looking for new ways to relate, prioritizing the quality of touch, caress, kisses, prolonged hug. And speaking of affection, communication is really a fundamental pillar here. When there is a relationship, it is very important that both parties are aligned about desires, difficulties, fears, and expectations. It is not always easy to talk about what you feel, especially when it comes to a topic that has been repressed for so long. However, when a space of mutual trust is created, the couple can adjust the harmony and find ways to deal with any changes, whether hormonal, emotional, or health. For people who are single or widowed, their own perception of sexuality can change. It is common to think that, without having a steady partner, there is no reason to think about sexual desire, but this is not necessarily the case. The search for pleasure and intimacy can manifest itself individually or in new relationships, depending a lot on the preferences and moment of life of each person. An essential point for those who want to increase libido naturally is the practice of physical activities. This is because regular exercise improves circulation, promotes the release of endorphins, and helps regulate hormones that influence mood and sexual desire. In addition, keeping the body moving helps with flexibility, muscle strength, disposition, and consequently, self-esteem. You don't have to do anything too radical. Daily walks, Water aerobics, yoga, Pilates, or any exercise that is pleasurable for you can bring benefits. The important thing is to look for something that fits into your routine and that respects possible physical limitations. And always remember to talk to a doctor or physical education professional before starting any more intense activity to avoid injuries. Another aspect that deserves to be highlighted is food. What we eat directly impacts our overall well-being and, therefore, our sex life. A diet rich in fruits, vegetables, legumes, whole grains, and lean sources of protein favors blood circulation and hormonal balance. Foods such as avocados, nuts, walnuts, almonds, and omega-3 rich fish, such as salmon and sardines, contribute to heart health and can improve mood. Drinking plenty of water is also key, as dehydration can cause fatigue and reduce vitality. On the other hand, excessive alcohol consumption, smoking, and excessive intake of processed foods can impair libido, either by affecting circulation or by decreasing energy or affecting mood. One approach that many people find beneficial is the adoption of relaxation and stress reduction techniques. And there's no denying that stress is a great enemy of sexual desire. It can disrupt sleep, increase anxiety, and therefore decrease the desire to engage in moments of intimacy. Practices such as meditation, deep breathing, yoga, and even pleasurable hobbies such as gardening or painting can help reduce tension. When the mind is calmer, it is much easier to open up to the stimuli of pleasure, because the person is not busy with constant worries. Of course, sometimes the challenges surrounding libido aren't just about habits and lifestyle. In some cases, deeper emotional factors may be at play, such as trauma from past relationships, psychological blockages, or even a history of abuse. In these situations, therapy can be a great ally. A good psychologist or sex therapist can help you understand the roots of these issues and work together on solutions that lead to the resumption of desire in a healthy and safe way. There is no demerit in seeking professional help. On the contrary, it is a sign of self-care and responsibility for one's own health. In addition to taking care of the mind, it is equally important to pay attention to medical conditions that can influence sexual desire. For example, diabetes, hypertension, and cardiovascular problems usually affect blood circulation and, consequently, sexual function. Some medications for these conditions can also have side effects that decrease libido or cause sexual dysfunctions. Therefore, if you suspect that the medicine you are taking is impairing your desire, talk openly with your doctor. Sometimes it is possible to adjust the dose or change the medication to minimize these effects, always taking into account the safety and effectiveness of the main treatment. Don't interrupt anything on your own. The ideal is always to seek professional guidance. Remember that sexuality is not just about the sexual act itself. Especially in old age, pleasure can come in various forms, whether through a longer affection, a hug that warms the heart, a moment of complicity when watching a movie, or even sharing a special meal. This expansion of the concept of intimacy is very enriching, as it takes the focus away from specific performances or goals and focuses on emotional connection, affectionate touch, and the appreciation of shared time. Often desire also feeds on these simple but meaningful instants that remind us how good it is to be alive, to feel, to be moved, and to allow yourself. Let's think now about some practical changes that can be inserted into the routine to revitalize sexual desire. The first is to set aside specific moments to take care of yourself. This could mean reading a good book, walking outdoors to observe nature, or simply sitting quietly for a few minutes to pay attention to your own breathing. The idea is to create small self-care rituals, which will nourish the mind and spirit, making you more open to experiencing pleasure in other contexts. Secondly, try to get closer to people who are good for you, cultivating bonds of friendship, participating in community groups, exchanging ideas, and even sharing doubts about sexuality with those who feel comfortable can be extremely liberating. The exchange of experiences brings comfort and shows that you are not alone. It is also worth highlighting the importance of knowing one's own body. Over the years, it changes, and some things that were once pleasurable may need adjustments now. Giving time to explore new touches, new rhythms, and new sensations is a way to discover paths to pleasure that may not have been imagined before. Often, this phase of life offers the opportunity to rediscover oneself with less external pressures. with more maturity and awareness of one's own needs. This can be lived alone or in partnership, and in both cases the experience can be very positive. Another point that deserves attention is the issue of lubricants, because with the decrease in hormones, there can be vaginal dryness that makes sexual intercourse difficult. The use of water-based or even silicone-based lubricants, depending on the medical recommendation, can make intercourse more comfortable and pleasurable, avoiding discomfort. This is a simple, accessible, and often neglected resource due to lack of information. In addition, when there is pain or discomfort, it is difficult to have desire, as the body begins to associate sex with something unpleasant. Taking care of these small details is essential to keep your libido active. For many couples, rediscovering intimacy includes experimenting with new forms of affection that don't necessarily involve penetration. Massage can be one of these options. In addition to relaxing, it promotes skin-to-skin contact, awakens sensations of pleasure, and brings the couple closer, establishing a more conducive climate for libido to manifest itself. The key is to take your time and allow your body to respond at its own pace. After all, maturity also brings the opportunity to experience sex without the anxiety of youth, focusing more on the quality of the moment than on quantity or performance. It may also be interesting to include in the conversation examples of people who have decided to look at their own sexual health and have significantly transformed their lives. Imagine someone who, after the age of 60, started practicing meditation and realized that, by reducing anxiety, they felt more willing to connect with their partner. Or another example of someone who has changed their diet and inserted exercise into their routine, reaping not only benefits for the heart and joints, but also a positive impact on libido. These reports show that, if there is openness to changes in habits and new experiences, sexuality in old age can be surprisingly satisfying. In a long relationship, such as a decades-long marriage, it is normal for phases of less sexual interest to occur, either on the part of one of the partners or both. In these moments, it is crucial to maintain dialogue. Try to understand if there is something beyond the biological factor, such as communication problems, harbored resentments, or lack of quality time together. Sometimes a lack of desire is just a symptom of other unresolved issues, and working on these issues together can bring back the intimacy that was thought to be lost. Of course, each couple and each person is unique, so there is no ready-made formula that will work for everyone in the same way. However, the sum of physical, emotional, and relational care is usually the basis for maintaining or even regaining sexual interest. And when we talk about physical care, we include looking for a trusted doctor for routine exams, as many health conditions can be treated more efficiently when diagnosed early. Keeping medical follow-up up to date makes it possible to identify hormonal imbalances or other organic factors that, if corrected, can greatly improve quality of life, including the sexual aspect. Another point that we cannot leave aside is the influence of the environment. Creating a cozy atmosphere in the bedroom, investing in soft sheets, lighting a scented candle, or even putting on quiet music can help slow down the mind and stimulate the senses. These small changes of scenery may seem simple, but they make a difference, as they signal to the brain that it is time to relax and prepare for pleasure. In addition, as already mentioned, eliminating sources of stress is essential. So, avoid bringing arguments or everyday problems to bed, as this only increases tension and decreases desire. Many elderly people end up closing themselves off from sexuality for fear of judgment or criticism from family and society. It is important to remember that life is yours, and that cultivating your own pleasure is not something to be condemned, but celebrated. The people around you need to understand that your well-being does include keeping the sexual flame burning, if you so desire. Once you're comfortable with it, sharing this view can help break down prejudices and bring more lightness to family conversations. Still, if you prefer to keep your intimacy private, that's your right. In many moments, the issue of libido can be directly linked to the way you see the aging process. If you associate advancing age only with losses and limitations, you may end up leaving aside interests and pleasures that could remain active. But if you face maturity as a phase of self-knowledge, wisdom, and the opportunity to live sexuality more deeply and consciously, you will be taking a significant step so that desire remains present. It may also happen that there is a certain embarrassment in addressing the topic with the partner or with health professionals. However, talking about sexuality with trained doctors or therapists is increasingly common and necessary to clarify doubts and receive informed guidance. If you feel embarrassed, remember that these people are used to talking about these issues and, if they are good professionals, they will conduct the dialogue with warmth and empathy. For those who face a grieving process for the loss of a companion of many years, the path can be a little more sensitive. In this case, it is necessary to respect the time of elaboration of the loss, without haste or external pressures. Still, when the person begins to feel ready to think about new possibilities of affection and desire, it is important not to close themselves off to opportunities. It may happen that the desire to relate again arises, or even to rediscover one's own body through solitary pleasure. All of this is part of a personal process, which varies according to each one's history. In general, all these points converge on the idea that sexual health in old age depends on a set of factors. There is no miracle remedy that will solve everything, although some medications can help with specific issues under medical supervision. But the focus here is precisely to present ways to increase sexual desire without depending exclusively on medications, but with lifestyle changes, healthy habits, investment in communication, and self-knowledge. The main message is, it is indeed possible to live a full and satisfying sexuality in maturity, as long as due attention is given to all aspects involved: body, mind, emotions, and relationships. It is a phase in which the rush can be less, giving space for the exploration of new sensations without the pressure that sometimes prevails in youth. It is time to allow yourself to value the experience acquired throughout life and to open yourself to discoveries that can be surprising. Therefore, if you feel that the desire is no longer the same or that you are facing some difficulty, consider all possibilities. Talk more openly with your partner, adopt healthier physical and eating practices, seek relaxation techniques, try a longer and more affectionate touch, use lubricants when necessary, seek psychological support or couple therapy, adjust medications that may be affecting libido, and above all, respect your rhythm and your wishes. You are not alone in this process. Many mature people are doing exactly the same movement, looking inside, understanding that they still have a lot to live, including sexual pleasure, and looking for ways to make this experience something positive and enriching. The secret is to respect individualities and keep an open mind to realize that sex life can indeed remain active, interesting, and even better than before. It may be that on this journey you encounter contrary opinions or a certain prejudice, but remember that taking care of yourself, including your sexuality, should not be a reason for guilt or embarrassment. On the contrary, it is a sign of self-love, respect for their wishes, and the search for a better quality of life in all senses. Coming to the end of our conversation, it is important to reinforce the message of hope and motivation. You have in your hands the possibility of resignifying sexuality in old age, adopting strategies that involve body, mind, and heart. Take time to reflect on what you can improve in your routine, what conversations need to be put on the table with your partner, and what adjustments are possible in your diet or exercise. If you think you need professional help, don't hesitate to seek it, whether it's a doctor, a psychologist, or a sex therapist. The mature phase of life can indeed bring some challenges, but it can also be a period of great freedom, self-knowledge, and satisfaction. Sexuality, when seen naturally and integrated with the rest of life, has the potential to bring numerous physical and emotional benefits, such as improved mood, strengthening affective bonds, reducing stress, and even strengthening the immune system. Therefore, let you allow yourself to discover or rediscover all this, always in a respectful, empathetic, and conscious way. I hope this conversation has helped to clarify some issues and, above all, to inspire you to seek even more information and practices that can enrich your daily life. Every step taken towards genuine care of one's body and mind is a step towards a fuller, healthier, and happier life. And remember, sexuality is a fundamental part of the human being at any stage of life, and dealing with this subject naturally and welcoming is everyone's right.